Welcome to Steady Balance on Spotify, your space to understand the science behind balance and vertigo.
Myself, Dr. Jaydeepsinh Makwana, ENT surgeon from Mangalam ENT Hospital, Ajwa Road, Vadodara. Right now, there are many confusion to the patient regarding where to go when patient feeling dizziness or a vertigo or giddiness. So today we are discussing on that only. So the confusion is gone and everything will be clear cut where to go, to whom, to which doctor, whether it's a ENT doctor or a general physician doctor or any other specialty like a neurosurgeon or neurophysician. So first we will start with, if you ever had vertigo or ongoing dizziness, you will know the symptoms are only part is not knowing where to go. Some people start with one doctor, then get referred to another and another. Meanwhile, the dizziness continues, daily life gets harder, and the whole experience becomes frustrating. So today, let's make this simpler. So we will clear it out where to deal when dizziness or vertigo and who to consult first, which specialty. For most of the people, the first step is the general practitioner will take full history. He will check your diabetes, anemia, blood sugar level, blood pressure level, and narrow down what kind of dizziness is going on. If the dizziness is triggered by turning in bed, looking up, or changing head position, one common cause is benign paroxysmal positional vertigo. Short form, it can call as a BPPV. A general practitioner can often diagnose this with the Dick-Solpike test and may also be able to treat it with a repositioning maneuver such as Apley's maneuver. That matters because it can be managed without a long chain of referrals when the problem is identified early. If the symptoms suggest an inner ear problem, the next doctor is usually an ENT specialist. ENT stands for ear, nose, throat surgeon. Commonly managed conditions such as BPPV, Meniere's disease, and vestibular neuritis. This becomes especially relevant when dizziness becomes with hearing loss, tinnitus, that is ringing in the ear, or earfulness or repeated vertigo attacks, because that pattern often points more strongly towards the peripheral vestibular disorders. ENT specialists can also arrange formal vestibular testing when the diagnosis is not straightforward. But not all dizziness is mainly an ear problem. Sometimes the pattern points more towards the brain or nervous system, and that is when neurology becomes important. A good example is vestibular migraine, one of the most common cause of recurrent vertigo. Sometimes do not realize migraine can present with a dizziness, motion sensitivity, nausea, or visual discomfort even when headache is not the main complaint. Neurology is also important when dizziness accompanied by symptoms such as double vision, slurred speech, weakness, numbness, severe imbalance, or other neurological warning signs. In those situations, doctor must think about central cause, including stroke. So when the story does not fit a simple inner ear condition or when there are neurological features, a neurologist is often the right specialist. Sometimes the most important part of the journey is not the specialist consultation but the testing. That is where a vestibular audiologist may come in. These clinicians perform specialized assessment and help identify which part of the balance system is affected. This may include tests such as video nystagmography, video head impulse testing, and vestibular evoked myogenic potentials. For patient, that kind of testing can help answer the question, is this really coming from the vestibular system? Or if so, where exactly? There is the part many people hear about too late, that is recovery. For persistent dizziness, imbalance, or motion sensitivity, a vestibular physiotherapist can be one of the most useful professional in whole pathway. Vestibular rehabilitation uses structured exercise to help the brain and body adapt, reduce symptoms, and improve confidence with movement. This is particularly important for people off balance, avoid movement, or have not returned to normal functions. In other words, treatment is not always just about diagnosis. Sometimes it is about retaining the system to recover well. So here is a simple way to think about it. If you have brief spinning with head movement, start with your general practitioner and ask. It could be benign proximal positional vertigo associated with head movement and change in a position related to lying down or in a bed. Then ENT doctor is the first and right next step treatment of vertigo or giddiness. If you have recurrent unexplained vertigo, especially with migraine features or neurological symptoms, neurologist may be more appropriate. And if you have persistent imbalance or slow recovery, ask about vestibular physiotherapist. So one of the hardest things about dizziness is not just the symptoms itself, it is the uncertainty, and often the right doctor is the one who helps turn confusion into clear path forward. Please speak with your doctor and take advice related to symptoms and treatment regarding to giddiness. Thank you.
A public awareness initiative by Dr. Reddy's. This communication does not substitute advice of a medical practitioner. Please consult your doctor for any medical advice.